Okay, what is the best ceramic implant system on the market? Or more specifically, what is the best implant system for you as a practitioner? In this video, we will explore exactly this question, and I will share with you the top 5 criteria a zirconia implant must meet to be considered as an option for our clients in our specialist training. Hi, if we haven't met yet, my name is Dr. Tobias Steinherr and I'm a dentist and specialist in ceramic implants, and I teach dentists proven methods to successfully integrate ceramic implants into their daily practice. Today, we will look at which parameters are essential when analyzing specific implant systems and considering whether it's suitable for us as practitioners or even as patients. And at the end of the video, by the way, I will share a shortcut to make this process even easier for you. To ensure some comparability, I chose 5 different categories. The unique aspect is that some categories somewhat contradict each other. This means if a system excels in one area, it might not perform as well in another. And this method allows us to compare different systems that cover various aspects. And as I said in the intro, I use the same approach with my one-on-one clients, and we also teach it in detail inside our Ceramic Mastermind. That's a specialist program and network for dentists who want to improve their ceramic implant skills on a fast track with several monthly live webinars, video trainings, and mentoring groups. And if that's something of interest for you, then you can find the links underneath the video as well. So first category is biology. These are the questions you should ask yourself when you assess a ceramic implant system. How biologically is the system constructed? How well does it mimic the natural tooth in its structure? Are there gaps or weak points that could harbor bacteria and promote inflammation? If so, where are they located? Are they at bone level, gum line, or somewhere in between? The importance of this category also depends on whether we are aiming to replace a single tooth as naturally as possible, or if the goal is simply to fix dentures using metal-free implants, for example. If we take a closer look at this example, and you heard me talking about those facts quite often already, we have those perpendicular fibers sticking to the root surface, and we can achieve something similar with our ceramic implants, even the same blood flow like around natural teeth, if we create the right conditions. So with a monolithic one-piece implant or a two-piece implant that's not made with an abutment like this SDS 2.2 here, we have a continuous surface without any gaps like with the natural tooth. Other two-piece systems connect on different levels with their abutment part somewhere within this zone we also know as biological width. This can create a gap and a hideaway for bacteria, as zirconia is so rock hard that this gap between two zirconia parts won't be sealed at all. So I differentiate between bone level, having this gap close to the cortical bone like most of the titanium implants, then elevated bone level where the implant sticks a bit out of the bone and connects somewhere in the middle of this biological width. Then we have tissue levels where the connection is slightly underneath the gum line, and the true tissue level, as I call it. These are the implants you can prep and therefore don't show any gaps, as they only have the crown margin following the existing tissue level, which is additionally sealed with cement. So if I would have to rank those different connections in terms of their biological performance, I would sort them somehow like this. So next category, abutment stability. Titanium, setting aside biological issues like foreign body reactions or biocorrosion for a moment, has a significant advantage as a material. It has a very high fracture toughness. This means it withstands bending and tensile stresses much better than zirconia does. Pure zirconia abutments had the problem of being very prone to fractures in the past. Consequently, the industry moved toward titanium bases with a zirconia superstructure or screw-retained crowns on titanium bases to leverage some benefits of zirconia while compensating for its drawbacks. With zirconia implants, we face the same issue of high stress on zirconia abutments. If we take a look at finite element studies, we know where the main stress appears under dynamic loading. It's right here, where the abutment connects to the implant. This challenge is addressed in various ways though. Just pure massive zirconia in the critical area like SDS implants are designed, only adding a post which extends the two-piece implant, basically turning it into a one-piece implant, then we have tried and tested titanium bases like those from Straumann, but this might be a problem for those dentists and patients looking for a 100% metal-free solution. There are abutments with a more flat-like internal geometry like those from ceramics, relying more on the screw connection, or the classic abutment designs in full zirconia like with Z systems, bone-level implants, which may face similar issues under dynamic loads as zirconia abutments on titanium implants. Additionally, depending on the diameter of the implant, all involved components, the abutment and the implant shoulders, become thinner and more prone to fractures. So, knowing about the problems massive zirconia abutments already had in the past, I personally would rather prefer a stable solution, especially in the molar area. Let's talk about the next section about screw connection stability. Beyond the abutments themselves, also the type of screw connections plays a crucial role in the longevity and the risk of technical complications. On one hand, there's often a desire for a completely metal-free restoration. Strictly speaking, this rules out all systems that use titanium screws, even if they're internal and not exposed to the external environment. On the other hand, zirconia screws come with potential complications. While zirconia is extremely pressure resistant, it's also brittle. Mechanical stresses like tensile shear or bending loads, as well as stress peaks in the thread tips or over-tightening beyond the recommended torque, can lead to fractures. The lack of elasticity also makes it challenging to achieve reliable preload forces. So there is a wide variety of possible technical complications with this type of screw connection. Kind of a middle ground is offered by metal-free screws made from glass fiber reinforced composites, such as the V-Carbo screw from ceramics. These materials have a much higher fracture toughness and elasticity, allowing them to better absorb stress. Unfortunately, as of today, I am not aware of any independent studies examining the long-term stability of those different connections. If you have more information, please share it in the comments. SDS just avoids those problems by not needing a screw. They have titanium and PEEK screws to fix their post, but the main connection and stability is achieved due to its cementation, so frankly, you don't even need the small screw to hold the post in place. It's more a convenience option. By the way, if you're enjoying the video so far, feel free to give it a thumbs up and subscribe to the channel. So the fourth and the fifth category deals with the same topic but applying it onto different aspects. It's about simplicity versus variability regarding the surgical and the prosthodontic options. Let's start off with simplicity. The fewer parts a system has, the simpler and more straightforward it is to use. This streamlines the planning process and keeps your logistics manageable. How often have you experienced forgetting to order the appropriate abutment when restoring an implant or ordering the wrong size or part? Especially in practices where many patients receive implants, it's pretty easy for something to be forgotten or overlooked. To avoid those kinds of problems, it can pose a significant financial burden and require considerable staff effort to keep all the possible variants of a system in stock, whether in implant lengths or diameters or prosthodontic components. And let's not forget the cost to patients, as each additional part added ultimately adds to their bill. The opposite of simplicity is variability, both on the surgical and prosthodontic side. Different shapes and lengths of the implant or abutment variations allow for a broader use across various indications. This can be crucial in surgery, depending on whether you place many immediate implants requiring specific implant lengths or thread designs, or if you place many delayed implants, for example, and need to anchor dentures in an edentulous jaw, which requires different components than a single crown, for example. But an excessive range of options can cause confusion and burden inventory and logistics, as we already discussed. However, having some choices makes it easier to respond optimally to different situations and cover various indications. So depending on the demands you place on your ceramic implant system, you can use these 5 criteria to effectively assess whether the system meets your expectations and requirements. Some might be more important to you than others, so maybe you will find yourself in the situation either to compromise somehow or to even choose 2 different systems for different requirements. And I promised you a shortcut in the beginning, but actually I have 2 of them. The first one is to make your life a little or even a lot easier. You will find a detailed white paper available for download in the description box. In this white paper, I cover all important facts about the 6 major ceramic implant systems in detail using those criteria we just talked about, as well as a table where you can compare all of the systems in one glance. I put a lot of work into this white paper to make your process of choosing the perfect system for you as easy as possible. If you have any questions, post them into the comments. And we will take it even a step further. In the upcoming weeks, I will do a whole video series where I will apply these exact criteria to the 6 major ceramic implant systems and discuss the potential advantages and disadvantages of each in a dedicated video. For now, make sure to subscribe to the channel and activate the little notification bell so you won't miss the video about your current system or the one that you're interested in. Have a great day, and don't forget, if we can do better, we should do better.